Hi friends, today we are going to discuss about the topic called glycogen storage diseases. There are 15 types of glycogen storage diseases, among which there are 5 important types. They are divided into these 5 is divided into type 1 to 5. 1, 2, 3, 4, 5. You can easily remember by the mnemonic VP CAM. V is Von Gogh disease, P is Pompe disease, C is Coris, A is Anderson's, M is McCurdle's. These are in order 1, 2, 3, 4, 5. Type 1, well, let's discuss this Von Gogh disease. Type 1 is Von Gogh disease. It is due to the deficiency of enzyme called glucose 6 phosphatase. Glucose 6 phosphatase. And here we can see the features like fasting hypoglycemia. Here mainly the liver unable to use this stored glycogen, like the gluconeogenesis won't happen and glyconeogenesis doesn't takes place. So there will be an increased glycogen in the liver and kidneys, and so hepatomegaly, renomegaly can be seen. Let us know, like due to the stored glycogen, there is an increase in triglycerides, increase in uric acid, so leads to gout. Everything will occur. And lastly, there will be an increase in blood lactate levels. Why I am stressing this blood lactate increases in type 3 Coris disease, everything will be same as Von Gogh disease. Mild symptoms like Von Gogh, but there will be a normal blood lactate level. Normal blood lactate levels. So that's why we are learning here increased blood lactate levels will be seen in Von Gogh disease. Next, Pompe's disease. How we will remember this Pompe's disease is, see, Pomp, P and P. First letter is this P and 1, 2, 3, 4. Fourth letter is P. So same letters P and P, Pompey. So this will be due to deficiency of alpha 1,4 glucosidase enzyme. Alpha 1,4 glucosidase enzyme. It is in one of the example of lysosomal acid, and or it is Pompe's disease is also due to the deficiency of acid maltase. And how these symptoms will be there, like Pompe's disease, how patient presents is same. This pump, how you will remember is pump. What are the pumps we know in our body? We know heart is a pump, and we know soleus peripheral heart, that is also muscle also pump, and like liver you remember. So these three organs involvement can be seen like cardiomegaly, and same like hypoglycemia, exercise intolerance. Main thing in Pompe's disease is tongue enlarged. Enlarged tongue will be seen in Pompe's disease. Type 3 Coris disease. How Coris disease will be present? You remember A, B, C, D. Anderson is branching enzyme, Coris is debranching enzyme. So C, D here. Coris is debranching enzyme deficiency. What are those debranching enzymes which are deficient? There are two. That is, first one is alpha 1,6 glucosidase and 4 alpha D glucanotransferase. These are the debranching enzymes which are deficient. So say we know these symptoms are similar to von Gierke disease, mild symptoms, and main importantly normal blood lactate levels. And one more thing is here, there will be an deposition of or accumulation of limit dextrons in cytosol. This will be the important point in which among the glycogen storage diseases limit dextrons will be accumulated in cytosol is Coris disease. And type 4, already A means branching enzyme, right? So it occurs due to the deficiency in the branching enzyme. How this patient will be present? Same as hepatomegaly, failure to thrive, and one more important thing is infantile cirrhosis, hypotonia, cardiomegaly. Everything is normal, like everything is similar to this cardiomegaly, hypoglycemia, everything is similar to Pompe. And you can see this failure infantile cirrhosis is the unique thing here to remember in Anderson's disease and branching enzyme deficiency. And last is McArdle's disease. M for M, muscle. So muscle glycogen phosphorylase deficiency. What? Muscle glycogen phosphorylase deficiency. Phosphorylase deficiency. Here we can see patient with presence with increased glycogen stored in the muscle, unable to utilize the glycogen stored in the muscle, so glycogen deposits will be seen in the muscle, and so there is an excess glycogen, so painful muscle cramps will be seen. Painful muscle cramps and myoglobinuria, so red urine will be seen. And patients also presents with arrhythmias. Arrhythmias mainly occur due to the serum electrolyte abnormalities. And last one is, we can see this second wind phenomena, also seen in McArdle's disease. What is second wind phenomena? Second wind phenomena means increased muscle blood flow during exercise. It is nothing but second wind phenomena. Here painful muscle cramps, patient presents with painful muscle cramps, myoglobinuria, arrhythmias, and second wind phenomena. What is the diagnosis is McArdle's, and what is the enzyme deficient is muscle glycogen phosphorylase. This is 1 year NEET PG question. And one more thing is INISET question was Anderson branching enzyme and Cori debranching enzyme. They match the following, they will ask. What are the debranching enzymes? Alpha 1,6 glucosidase and 4 alpha D glucuronase. And here in Coris disease there will be a normal blood lactase levels. When compared to the von Gierke's disease there is an increased blood lactate levels, and von Gierke's disease there is a glucose 6-phosphatase deficiency. And Pompe's disease, what three structures will be affected is heart, muscle, liver. And enzyme deficient is acid maltase or alpha 1,4-glucosidase enzyme deficiency. So in short, this is the glycogen storage diseases. Type 1 to type 5. Von Gierke, Pompey, Corey, Anderson, McArdle, VP Cam. So what are the enzymes deficient? In type 1 Von Gierke, glucose 6-phosphate. Type 2 Pompey, alpha 1,4-glucosidase or acid maltase. Type 3 Corey is a CD branching enzymes alpha 1,6,4 alpha D gluconeotransferase. And type 4 Anderson's disease is branching enzyme. Branching infantile cirrhosis is important. McArdle, muscle glycogen phosphorylase efficiency. It leads to this glycogen storage diseases. Thank you friends. Subscribe to my channel for more such videos.